Hello and welcome to the Fact Show YouTube channel. Make sure to subscribe and press that bell icon so you never miss out on one of our new videos. Now let's get into it. Here are 11 facts you must know about the coronavirus. Number 1. You should be careful while having sex. The virus isn't considered a traditional sexually transmitted disease since it's not spread via contact with genitals, but because it's transmitted through respiratory droplets, kissing can spread it. Now is definitely not the time to find a new intimate partner. It's now believed the virus can also live on certain hard surfaces, such as plastic or stainless steel, for up to 72 hours. I know some of you will be itching for some action in the bedroom, but take it easy. If it lowers the risk, then it's worth it. Number 2. If you're healthy, a disposable mask won't keep you safe from the disease. The disposable masks you find at the drugstore aren't able to filter out germy droplets that might get you sick. If you are diagnosed with coronavirus, then yes, a mask will help prevent your respiratory droplets from a cough or sneeze from infecting someone else, but if you're sick, you should be staying home and away from people. Number 3. You can't catch coronavirus from your pet. This is what Dr. Dasgupta had to say. Right now the CDC says there's no evidence that pets, livestock, or wildlife can transmit the disease to humans, but we're still unsure if humans can pass it on to their pets. So try to avoid having as many hugs with your furry friends if that's humanly possible. Number 4. The coronavirus pandemic won't end once warmer weather arrives. Not to be a downer, but here's the reality: rising temperatures won't bring the coronavirus spread to a halt. Dr. Vossen had this to say: the spread may slow slightly simply because there tends to be less coughing and sneezing during the warm months, but it's so easily transmissible that it will continue to circulate if we don't get a handle on it now. That's why social distancing is so important. Number 5. Over-the-counter meds won't make coronavirus symptoms worse. You may have heard that OTC pain meds like ibuprofen or acetaminophen can make coronavirus worse, but the World Health Organization has debunked that notion and other medical experts agree. That rumor just adds to the panic. There's no scientific evidence to back it up, says Dr. Dasgupta. In general, choose whichever option best treats your symptoms, says Dr. Vossen. If you have a fever, acetaminophen is generally best for that, but if you have inflammation or aches, ibuprofen works better. Number 6. Even if you don't have symptoms, you can still be contagious. What common symptoms should you expect? That landscape changes by the day, but as of now a high fever, dry cough, shortness of breath, and loss of sense of smell or taste are biggies to look out for. Some people are also thought to exhibit gastrointestinal signs like diarrhea, body aches, and upper respiratory symptoms like congestion. Keep yourself healthy by washing your hands regularly and staying inside. Number 7. If you're younger, you can still get coronavirus. In the early days of the pandemic, older adults and those with underlying or immunosuppressive health conditions were the populations considered to be most at risk. That's still true. Those demographics will be hit hardest if they do get sick, but we now know that people of any age can get coronavirus, including children. In fact, the New York Times recently reported that nearly 40% of hospitalized coronavirus patients in the US are under the age of 54. Number 8. A vaccine won't be available anytime soon. Scientists are hard at work developing a vaccine that can effectively fight the coronavirus, but it will be a long time before one is available to the general public. We want a vaccine, but there are multiple phases to reach FDA approval, and it's important a vaccine passes through all of them. Plus, this virus will continue to mutate, so we really want to get this right, says Dr. Dasgupta. Number 9. There are drug therapies being tested to fight coronavirus. As of now, there is no drug approved by the FDA to specifically fight the coronavirus. However, there are several existing drugs typically used to treat other inflammatory conditions that the CDC states are being administered to some coronavirus patients on a trial basis. Those include hydroxychloroquine, used to treat rheumatoid arthritis, and chloroquine, used to treat malaria. New York State is also launching a clinical trial to see if the rheumatoid arthritis drug sarilumab can effectively treat coronavirus. Number 10. No home remedies will kill the virus. If you've read that gargling with hot tea or vinegar will kill the virus, know that that's not true. These home remedies might ease your symptoms to help you feel better, but they do nothing to fight the virus itself, says Dr. Dasgupta. Another coronavirus combat tip to avoid: spraying yourself with household disinfectants. This is dangerous and should never be done, Dr. Dasgupta says. You should never ingest these products or apply them to your skin. And finally, number 11, it's not a Chinese virus. This term has been thrown around a lot lately, but it's absolutely incorrect, and just plain wrong to do so. Characterizing a virus based on a specific ethnicity or nation is racist, says Dr. Vossen. COVID-19 is part of an existing family of viruses called coronaviruses and has nothing to do with geography. In theory, the first case could have started anywhere. Dr. Dasgupta says he's seen the impact this type of language can have firsthand. Some of my residents and nurses are worried about the stereotypes and discriminations they might face while doing their jobs because of this xenophobia, he says. This is not the way we should talk about a virus or disease. So there you have it. Hopefully you learned some vital information that could help to save yours, or a loved one's life. This virus is a very serious matter and who knows when things will be back to normal, but for now, make sure you stay home as much as possible, and a massive thank you to all the essential workers still putting themselves at risk every day to save lives and keep the world going in this once-in-a-lifetime experience. If you enjoyed this video, don't forget to give it a thumbs up, leave a comment telling us how the coronavirus has affected your everyday life, and subscribe to the Fact Show YouTube channel for more strange, mysterious, funny, scary, interesting, educational, and mind-blowing facts. Peace.